Hello, I'm Dr. Salzman. I'll be your examiner for this station. Nice to meet you.
Nice to meet you.
You can have a seat.
Thank you.
I will provide you with some questions or prompts to take you through this scenario, and we'll have 10 minutes to work through this case. This is the procedure station. As you saw on the door sign, we're taking care of Mr. Sargent with left knee pain. All right. Let's start. Before we get to the procedure, could you start by describing the steps that you would take to prepare for the arthrocentesis?
Sure. I think the first thing I would do is talk to the patient and obtain informed consent, and then I would want to gather all the supplies that I would need to do the procedure.
Okay, you mentioned you would start by obtaining informed consent. Could you walk me through the process by which you would do that?
Yeah, I would talk to the patient and let them know sort of what the procedure is, in this case an arthrocentesis or draining fluid from the patient's knee. I would talk to the patient about the risks and benefits of the procedure. The risks might include things like bleeding or infection. The benefits of the procedure might include relief of the patient's symptoms and hopefully to provide a diagnosis for the patient's symptoms.
I see. Okay, so after having that conversation with the patient is agreeable to do the procedure and informed consent has been signed.
Okay.
Next, you mentioned you would gather supplies. Tell me what supplies you would gather.
Since this is a sterile procedure, I would want sterile gloves. I would want to get some sterile drapes. I would want to get some sort of skin antiseptic, some lidocaine or other local anesthetic, and probably get a couple of different size needles, a small needle to inject the lidocaine, and a larger or longer needle to perform the arthrocentesis, and a couple of different size syringes, like a 10 cc syringe for injecting lidocaine, and then a larger syringe for the aspiration of the fluid.
Okay, the supplies are gathered for your procedure. Next, we're going to move towards our task trainer.
Okay.
So the supplies for the procedure that you'll need are here. I'd like to orient you to our task trainer before we begin. So this is the patient's left knee. The lateral side is closest to you, the feet are down here, the head is up here, and then this is the medial side. You mentioned that you would get some supplies for anesthesia. Could you describe how you would do that?
Sure. I would take my 10 cc syringe and draw up the lidocaine. I would attach a small needle to inject the lidocaine after I identified my landmarks, and I would create just a small wheal in the skin before injecting lidocaine deeper into the tissue.
Okay. Now, before we prep the knee, you indicated you would identify your landmarks. Could you walk me through with this model how you would identify the landmarks?
Sure. If this is the patient's lateral side, I choose to do a lateral approach for the procedure. So I would want to palpate the patella and try to identify the superior lateral aspect of the patella. And that's where I would want to inject my wheal of anesthetic and then inject a little bit deeper to anesthetize my needle tract. And then that's the same approach that I would take for actually doing the needle aspiration.
Okay, because we can't inject lidocaine on this model, let's assume that the patient's been anesthetized as you've described,
Okay.
And then sterilely prepped and draped as you mentioned earlier.
Okay.
Okay, and then you can continue on with the procedure, and there are
Okay.
gloves there for you to use.
Great. Okay, I would grab my larger syringe and my larger needle, And taking the same approach that I use to anesthetize the skin, I would identify my landmarks. In this case, I'm taking a lateral approach. So I'm going to insert my needle along my anesthetized track. And as I advance the needle, I'm going to aspirate. And once I enter the effusion, I will try to drain as much fluid as I can.
Okay. And you have been able to successfully draw some fluid back. Let's pause the procedure right there. As
Okay.
you're drawing back fluid, this is what the fluid looks like as it is coming out of the knee.
Okay.
And so let's assume you've been able to get out all the fluid that you can from the knee. Continue on with the procedure at that point.
Okay. Once I've obtained all the fluid, I'm going to safely remove my needle and cap it and dispose of it. I would want to apply a bandage or a dressing to prevent any further leakage of fluid. And then I would want to send my fluid for laboratory tests.
Okay. The bandage has been applied as you've requested. You can remove your gloves. We're done with this part of the procedure,
Okay.
and then you can have a seat again and we'll finish off with the next one.
Okay.
You indicated that you would send the fluid for laboratory studies. Could you tell me specifically what you'd like to order?
I think I would order a cell count. I would want to order a gram stain and culture and crystal analysis.
Okay. Those studies have been sent to the lab. I'm going to turn my screen here so that you can see. Here is the fluid analysis, and what I'd like for you to do is to interpret the laboratory results and then provide a recommendation for the next steps for management.
Okay.
And let me know when you're ready to go on to the next one.
Okay.
Next is the gram stain.
Okay.
And the crystal analysis.
Okay. My interpretation based on these labs is that the patient's diagnosis is more consistent with a crystal arthropathy like gout, given the presence of crystals and the absence of organisms on the gram stain. So my treatment recommendation would include a course of NSAIDs, possibly colchicine, and steroids like prednisone.
Okay. Those interpretations have been communicated with the patient, and the prescriptions have been sent to the patient's pharmacy, and this concludes this procedure station. Thank you so much, and have a good afternoon.
Thank you.